The next topic is one that you both mentioned, healthcare. And I guess the question that I would have for you is, what would you do specifically, and why is your approach better than your opponent's approach? And I think it's Gordon's turn to start on
Sure.
this.
Well, first I'm going to acknowledge that the government actually has a responsibility to be proactive on the issue. And I mentioned this the other day, but even Governor Thompson said it should now be up to the states to ensure all individuals. We have a system right now that allows employers who provide health care to subsidize those who don't, who allow the public sector to pick up a large part of the costs. And for every uninsured person we have, tax dollars pick it up, premiums pick it up. We're seeing increasing cost shifting, and high deductibles are pricing people out. So I think getting people to actually acknowledge that there's a role for government to play, not necessarily in administering the system, but in leading with real reform that addresses the cost shifting and the inequality that exists in our current healthcare system. I'm open. I mean, I understand we would have it solved if there was an easy solution to this, but we need to start identifying that we need to do something about this, turn this disadvantage into a positive, and start moving forward like other states. I've mentioned before the Wisconsin Health Plan, the Wisconsin Health Care Partnership Plan. Both have elements to them that I think address some of the questions. I think they're good starting points, but the reality is we have not had people in there, the Assembly, who've been committed to real health care reform. They've been just focused on, individual policies that benefit some at the expense of others. And so, I am not sold on any one specific plan, but getting people committed to the issue for both public sector expenditures and private sector expenditures, as well as access, has to be a goal of anybody who's elected.
And Julie, what's your approach?
Well, absolutely. And again, I agree with Gordon. It's a huge problem. I think the only thing that everyone agrees on is that there is no easy solution. The role of government is another huge part of the debate. How large should that role be? Taking the lead in the discussion? Sure. That I think everyone could also agree upon. Do we go toward a more government-controlled system or a more market-driven system, and then certainly have plans in place for taking care of those who cannot be covered within the system that most citizens would be taken care of. If we're going to aim for affordability, accessibility, quality, and patient choice, those are four things that a lot of smart people have already put attention to and are coming up with no easy solutions. Quality demands some cost. The cost of healthcare is high, in part because some things have gotten out of control, but in part because it costs a lot to provide high quality care. It costs a lot to have the equipment, to have the healthcare providers, to have the speed with which people get their health care, and all of the things that Americans are used to. A one-size-fits-all plan is probably not something that citizens of the state of Wisconsin would agree to with great ease, and that's the challenge we face. The Wisconsin Healthcare Plan and the other plan that are already on the table have immediate anticipated problems, or at least some fiscal problems that are outlined by the Fiscal Bureau. One as high as an $8.7 billion deficit right off the start. Cost is a huge problem. I will enter the discussion, and I will bring with me a commitment to finding solutions and finding basically free market solutions that will cover most of the people, and then providing something that will cover those people who are uninsured.
I would say that one of the biggest challenges has been that we've had an assembly, again, that is not committed to healthcare reform, that is only committed to gimmicks like HSAs, which is another code word for the healthy and wealthy plan. The average person that has the average income of someone with a healthcare savings account is $131,000 in this country. They're largely provided to be tax shelters, and it doesn't do anything to address the cost of healthcare. I think before we talk about if we can't get to wholesale reform, I think there are some things we can do both in the short term. About 5% of people are responsible for more than 50% of healthcare costs. So I think if we can, provide some catastrophic relief to address those, at least make sure everybody has catastrophic insurance. So if they have major organ failure or a big accident and they don't have health insurance, we can make sure they're covered. I think we've even seen some things locally that would be a model. Our Living Healthy Clinic, for instance, that serves lower income people, can get them prescriptions, can get them referrals, is a much more affordable way of treating people than having people go directly to the emergency room. So I think if we can utilize maybe even just a little bit of money to beef up the exposure of these clinics and let people know that if they're sick, to go to the clinics instead of going to the emergency room, there's savings to be achieved there. Would also say that we need to look at some long-term savings as well, and that, putting some incentives in there to encourage healthier lifestyles. We have 25% of people in Wisconsin, adults, smoke. We know what kind of health traits lead to long-term chronic illnesses and diabetes and all of these things that if we encourage healthier lifestyles, we can save money in the long run. And I think that needs to be one of the emphases of, our healthcare reform.
There are some good aspects to the plan, for example, in Massachusetts. I think we would have to be extraordinarily careful about putting more responsibilities on the backs of business owners who are already leaving Wisconsin because of high tax burdens. But there are some interesting aspects, including some things that we could maybe expand upon here in Wisconsin if we begin this discussion. If business owners could get tax credits and put not more money than they already are into health care, but the same amount, and then give ownership to those employees for using those tax dollars. Those are the kinds of things we need to start talking about, so patients have more control over where they're going to get their health care, who they get to see for their health care, and if businesses have some ownership of these health care dollars, tax incentives for the health care dollars, they will invest perhaps in prevention right in the workforce. I talked to someone right here in town who's a member of a group called the Oshkosh Business Coalition on Health, and they have begun an effort to discuss these challenges and are looking for solutions. We need to be open-minded about every possibility. I disagree that Republicans have
They didn't hold a single hearing. I mean, all these bills we're talking about that we have early interest in, they wouldn't even hold hearings on.
I guess I could change that, couldn't I?
Good luck.
Thank you.
I guess we're done with the health issue for the moment.
Well, I'll just say one more thing.
Sure.
Julie just cited that companies are leaving because of taxes. Well, when CEOs of companies in Wisconsin were actually asked about it, they said healthcare costs were their biggest concern, and actually taxes were there at the bottom of their list. And so, if we're going to listen to what CEOs said in that May survey that WMC did, healthcare costs would be at the top of their list. And we've seen numerous occasions now where companies are actually moving to Canada because they have stable, fixed, free healthcare.
Free healthcare. One of the problems with our system, it could be stated that a third-party payer system is part of the problem, that patients don't see the cost of healthcare, and that's part of the problem with our healthcare system, is that private payers cover the cost of those who don't pay the premiums for their health care. And it's a system that needs to be looked at very, very carefully from top to bottom with bipartisan effort and with as limited finger pointing as possible, in my estimation.